Good afternoon, everyone, and welcome back to another Monday session of Pre-Medical Presentations. My name is Ms. Shinondo, here as part of Corporate Communications at LAMU. Today's topic is functions, probability, and its application in medicine. I would like to acknowledge the presence of our professorial team, Professor Njelasani, Professor Lambert, Professor Mudenda, Professor Mwawa, as well as Professor Mulenga, Professor Mwansa, Professor Emaus, Professor Gilani, Professor Kasolo, Professor Kumar, Professor Viemba, and many more. Today is an interesting topic as it explores how functions, probability, and the like actually do have their place in medicine. For example, a number of people would ask, why do I learn math? Why do I learn physics if I'm going to do medicine? So this is a part of where you will see its application and its real-world uses. Once again, these presentations are presentations for our students, by our students. This is for skill set building at a foundational level within all of our students. Skills such as long case presentation, public speaking, self-presentation, as well as online etiquette. I would like to invite our moderator, Mr. Nyorongo Tu, briefly introduce the topic and begin the presentation. Moderator, the floor is yours.
Good afternoon, Professor Ahmed and Dr. Nobutin. I wish to welcome you to this Monday presentation, 15 hours, from the Medical Sciences Department of Mathematics. We are presenting to you a very important topic, function and probability. And allow me to present you or invite the first presenter to this presentation. Thanks.
Good afternoon, esteemed ladies and gentlemen. My name is Noel Graham Winter. I'm one first year, second semester student at the prestigious Lusaka Alex Medical University in pursuit of my degree in medicine and surgery. Today, along with my peers, will take you along a journey that's bound to be very, very interesting. We'll take you along the roles, implications, as well as the applications, probability, functions in medicine. Before I start this presentation, I would like to acknowledge the presence of various deans, professors, and peers. It is a great honor and privilege to be bestowing this presentation among you today. There's a quote that I recently heard from one of my peers. He said, and I quote, "Mathematics is the unsung hero of medicine." And I couldn't have agreed more. So much so that I actually intend on taking the quote all for myself. Mathematics has a crucial role in medicine, and here we are going to present it. A lot of times when we think of medicine, we think biology, we think chemistry, but we don't pay as much attention to this. And after this presentation, we hope to change that. The list of applications, roles, and importance of probabilities and functions in medicine is abundant. Going through them all will be time-consuming. So we've compiled a very few examples that we feel is going to convey a deep understanding on the roles, applications, and implications in the medical world. Allow me to get started. So pharmacokinetics. So a lot of us might be wondering, what exactly is pharmacokinetics? So pharmacokinetics is the study of how the body responds or reacts to administered substances. So we have drug absorption, distribution, metabolism, and excretion. It can be abbreviated by ADME. Can be modeled using exponential functions. For example, a concentration of a drug in the bloodstream over time often follows exponential decay curve. This helps determine appropriate dosages and dosing intervals. I'd like to mention two very key important points here. The first one being exponential decay curve. We'll get into more detail about the exponential decay curve later. The second one being appropriate dosages, dosing intervals. I'm sure a lot of us have visited doctors before, and I'm sure a lot of doctors can relate to this. When they prescribe medication, a lot of times they tell you, take X amount of, for example, pills, or X amount of this medication in X amount of days. Maybe, for example, 3 times a day. This is exactly where probability and function plays a very crucial role in medicine. Epidemiology and public health. So again, epidemiology. Epidemiology is the study of how a disease spreads and infects a population. Mathematical functions can be used to model the spread of diseases, predict outbreaks, and understand the impact of interventions. Developing medical devices. Medical functions can be used to develop medical devices like pacemakers and insulin pumps, which rely on complex algorithms to function properly. Along with that, just to add on, we can also classify an electrocardiogram in this. Electrocardiogram is commonly known as an ECG. Understanding the impact of environmental factors on health. Mathematical functions can be used to model the impact of environmental health factors like air pollution and climate change on health. Interpreting diagnostic tests. Medical students need to understand sensitivity and specificity. I want you to pay very close attention to those two words, sensitivity and specificity. We'll dive into it deeper in a few. And predictive values to interpret test results correctly. This helps in assessing whether that a patient actually has a disease, given a positive or negative test result. Bayes theorem. You might also be wondering, what exactly is the Bayes theorem? The Bayes theorem will also be discussed shortly. Epidemiology and public health. So now let's take a look at functions. Now let's take a look at probability. Probability is crucial in epidemiology for understanding disease transmissions, outbreak, investigation, and vaccine efficacy. Very similar to functions, but here I'd like to outline vaccine efficacy. Vaccine efficacy is basically how effective is a vaccine. Take, for example, 2 people. One is vaccinated, the other one is not. The vaccine will say this person has 90% chance, 90% efficacy. That's how vaccine efficacy noted by percentages. So this means that this person who has been vaccinated is 90% less likely to contract the disease, while the person who is vaccinated is 90% chance to contract the disease. Analyzing medical data. Probability is essential for analyzing and interpreting medical data, including identifying trends, patterns, correlations. Ladies and gentlemen, my role in this presentation has come to an end. I would like to call Chair to take over. Thank you very much.
Name is Culture, a student at Osaka University. During my medical sciences study, I'm in my first year, second semester. Now, before I go any further into functions, I'd like to acknowledge the presence of a professor and in the audience as well. All protocols are highly observed. So I'm going to define what a function is and give you what examples on functions. A function is a relation and set out, provided that every input is uniquely marked with a specific output. Now, there are various and many types of functions, but for the sake of this presentation, we are going to talk about 3 functions, which are a quadratic function, an exponential function, and a trigonometric function. Now, a quadratic function is any function that is displayed on your screen, that is written as it is displayed on your screen. And this function can be used to determine precautions or treatment in case of a outbreak. An exponential function is any function that is written as it's displayed on the screen. And this function can either be used to determine a decrease or an increase in the variable. This trigonometric function is the function that is being displayed onto your screen. Now, onto my work examples. My first work example is on an exponential function. Now, this exponential function is raised to a positive value of x. And any function that is raised to a positive value forms a growth exponential graph. In the medical sector, this growth exponential graph can be used to determine how positively a patient is responding to a certain medication. Now, my next example shows a rational function. And I'm told to prove that this function is one-to-one, and also to sketch a graph of this fractional function. As I saw, this function really is indeed one-to-one. And in the medical sector, one-to-one functions can be used to determine, for instance, if a malaria patient has been given an anti-malaria drug, and this anti-malaria drug actually works onto his patient, then the relationship between this anti-malaria drug and the patient is one-to-one. Now on to plotting this beautiful graph. As you can see, I've plotted this beautiful graph. Now to plot this beautiful graph, we need two very important lines, which are the vertical asymptote and the horizontal asymptote. Now let me just go back. We are using the first function to find these two important lines. Firstly, I'm going to define what an asymptotic line is. An asymptotic line is a line that should never ever be made by a graph when you're plotting. Now, to plot the vertical asymptote, we say the denominator of this function should not be equal to 0, because if it is equal to 0, then this function is going to be undefined. Now, having solved that, the denominator is not equal to 0, I found my answer is -3. Then my vertical asymptote is -3. To find the horizontal asymptote, we say y is equal to a over c. And in this case, our a is 2 and our c is 1. And that gives us the horizontal asymptote as 2. Having found those two very important lines, I'm loading this beautiful graph. This is the end of my part of the presentation. I'm going to come for the next speaker, Tonwan. Thank you very much.
Thank you so much for the introduction, Lord. First of all, I would like to acknowledge the presence of the professors, deans, and our LAMU faculties for present. My name is Konrad Nikiri. I am a first-year, second semester student at Apex Medical University doing the pre-medical sciences. So I'm here to answer a burning question that has probably been on all of your minds. What exactly is probability? I'll tell you that probability has everything to do with chance and occurrences. The definition will tell you that it's defined as the measure of occurrences that an event will occur, and the measure of how likely an event will occur. So probability can either range from 0, meaning it's impossible, to 1, meaning it's possible. So there are three types of probabilities, namely classical or theoretical, empirical or experimental, and subjective. So in classical or theoretical, this type of probability focuses more on the positive outcomes of your experiment. Empirical or experimental focuses more on the amount of experiments conducted. And lastly, subjective. Subjective is also called, subjective is based on the opinion of the person who's conducting the experiment. It's also called judgmental. So to help you visualize probability, we have prepared contingency table. This contingency table shows 2,000 randomly selected couples were being tested for whether or not they had the unknown virus. So as you can see, they were divided into male, female, positive, and negative, each of them with their respective totals. So we were given a question that says to find the probability that a person, if at random, is a male, such that the person tested negative. So to answer this question, first of all, we are going to let M represent a male and N represent the negative test. So as you can see on your screen, I have displayed a formula and the way to solve this probability. But when you look at the first part of the equation, you can see that you can probably think that it means P open brackets M divided by N close brackets, right? No, it's actually a longer sentence than you think. It means M such that N has already occurred. So it will equal to the probability of a negative male divided the probability of negative as a whole. So we found that our probability was 0.58. Sorry, please hold it. Apologies for the interruption. So as I was saying, when we finished solving this question, we found that the probability of a male such that he's negative was 0.58. I will end my section of the presentation here and allow the next presenter, Hospital, to take over. So I would like to observe all protocols in which you all. Standing before you is Patel Mas, a first year, second semester student at the mighty Lusaka Appleton University. So I'll be guiding you through the applications of functions in medicine. So there are many applications of functions in medicine, as my colleague Winter has mentioned. But we will take a look at some few examples, real life examples. And functions help mathematical functions help model many, for example, drug absorption, heart rate, and SIR models. These help in epidemiology. So drug dosage calculation, also known as pharmacokinetics. The drug concentration in our body, in our bloodstream, follows a exponential decay curve, meaning it decreases with time. So the function used to calculate the concentration at time t is given on your screen, where C naught is the initial concentration, and K is the elimination rate of the drug, and T is time. So now the next is the graph shown on your screen is the exponential decay of a drug concentration in your blood. So in this example, we see that our initial concentration was 500 milligrams, but then it decreased over time. Now you must be wondering, how do we use this equation to find our concentration? So let's take an example, look at an example where and say that 500 milligrams of a drug with 4-hour half-life. Now, how much will remain after 8 hours? So, using our equation, we get that concentration at 8 hours will be 125.2 milligrams. Now, you must be wondering how does this help doctors and medical professionals? So, this helps especially doctors, to calculate how many times you should take a medication, so that the concentration of the medication stays within a therapeutic concentration. It doesn't increase, go above the limit or below the limit. Now, applications of functions in clinical practice. So we can calculate heart rate using functions. So a patient's heart rate varies with time and follows a sinusoidal function, as shown on your screen, where 70 is the 70 beats per minute is the heart rate at rest. So now, if we want to calculate our heart rate at 10:15 during exercise, we will use our function and get that it's 80 beats per minute. Now, this same function is also used in producing medical devices. An example of this is the fitness tracker or an electrocardiogram. Now, next is the graph of a sinusoidal function, which is followed by the heart rate. As you can see that our baseline, which is 70, shows that approximately our heart rate should be 70 beats per minute at rest, and then it increases as time goes on, especially during exercise or when the day is too hot. Now, functions in public health. So functions are used to determine how disease spreads. This model is known as the SIR model. In this model, our population is divided into 3 groups. Number 1 is the S group, where this means that people who are susceptible, meaning people who can catch the disease. Number 2 is the I group. This means that people who are infected, meaning they already have the disease. Number 3 is the R group, meaning people who have recovered or are immune from the disease. So in the S group, we might have additions. These additions can come from either births
or immigration, meaning people from other countries coming into our country. But there might be deaths taking place in this group. A death that is a natural death. Then again, this decreases the number of people in this group. Now, the movement from in this model, people move from one group to another. So the movement from S group to I group happens at the rate shown on your screen, which is beta Si. Again, there can be a decrease in the number of people in the IA. This is due to the infectious death, meaning people who are dying cause of the disease. Again, people move from I group to the R group, which is the recovered group, at the rate gamma I. Again, there is a decrease seen in this group by natural death, meaning people who have already recovered but then they die naturally. So this model can be used to calculate new infections per day, meaning we can get new infections every day. So we derive differential equations from the information above as seen on your screen, where beta, gamma, and the basic reproduction number is, these are the important parameters in this model, where beta is equals to the number of contacts with infectious people multiplied by the probability of the disease spread. And gamma is calculated using 1 divided by the duration of illness. An example of this is 10 days where influenza outbreak occurs. A patient is normally ill for 10 days. And then the basic reproduction number is calculated using beta divided by gamma. So this basic reproduction number will be discussed further, where we can use it in probability also. So now let us look at an example where an influenza outbreak occurs in a community of 10,000 people. And we have 100 people initially infected from this disease. Now we can use our differential equation DIDT to calculate new number of cases every day. So using our equation, we get that it is 188 new infections every day. So now you must be wondering, what are these lines and curves on your screen? These are curves that are very important and are studied in the SIR model. So as you can see, the blue curve shows the susceptible group. As you can see that from in the beginning, from day 0 to day 20, most of our population is in the susceptible group. But then as the red curve, which is the infected curve, as it increases, the number of susceptible people decreases, showing the movement of people from S to the I. Then you can see that at day 20, that is our peak, meaning this is the day where we have most of our population being infected from the disease. But then you can see that there is a decrease in the curve. This is due to government intervention and vaccination. So this decreases the number of infected people, and people recover from the disease and are immune, as you can see through the flattening of the red line. And then the green curve then increases and stays on top, showing that most of the people have become immune from the disease. Now, role of probability in medicine. Probability is used in disease diagnosis and testing. So there are two main important words as medical professionals we need to understand. Number one is sensitivity. Sensitivity is the probability of correctly identifying diseased individuals. Specificity is the probability of correctly identifying non-diseased individuals. So now let us look at an example of a COVID-19 test with 95% sensitivity and 90% specificity. 95% sensitivity means that out of 100 people that are being tested, 95% of diseased individuals will be identified, meaning there might be some people that have false negative, meaning they are diseased, but then the test does not show that they are diseased. Then 90% specificity means that 90% out of 100 people that are not diseased will be identified, but then 10 people will have a false positive. Probability can also be used in risk assessment in medical decision making. So probability helps estimate disease risk based on factors like age, lifestyle, and genetics. An example of this is the Framingham risk score, which predicts the heart disease risk. So this Framingham risk score predicts that in about 10 years, a person will or will not have a heart disease. So how does this model help us? This helps doctors and medical professionals change the lifestyle of the patient. If it estimates that a patient will have a heart disease in the next 10 years, it helps medical professionals change the lifestyle of a patient or give them drugs which can decrease the probability of that person having the disease in the future. And another example is stroke risk management, which follows the same procedure as mentioned for the heart disease. Another role of probability in medicine is treatment, effectiveness, and drug testing. Before a drug is produced and delivered to the population, it is tested and compared to a placebo. A placebo is not a drug, but is administered to a patient. So medical professionals conduct randomized trials which use probability to test the drug of and drug effectiveness. So medical professionals get the p-values, which are measures of statistical significance. And see, if, for example, p-value is less than 0.05, it means that the results are unlikely due to a chance. Then we can also use probability in survival analysis. An example of this is the Kaplan-Meier curves, which estimates the survival of a patient over time. This is mostly used in cancer research and other diseases. Another role of probability in medicine is epidemic and public health predictions. So probability models predict and control disease outbreaks. As we have discussed earlier, that our basic reproduction number, which equals to beta over gamma, measures how contagious a disease is. It is used in forecasting and public health planning. So let's take an example of COVID-19. So COVID-19 had a basic reproduction number of 3, meaning it will an infected person will transfer the virus to minimum 3 people. And this helps government plan on vaccine distribution. Then another example of application of probability in medicine is genetic counseling and personalized medicine. So probability models predict inheritance of genetic diseases. Examples of this are the Mendelian inheritance, which is the probability of inheriting cystic fibrosis and sickle cell anemia. We can even use probability in pharmacogenomics, which determines the likelihood of a drug response based on genetics. Meaning, depending on the genetics of a person, will the drug respond to a certain disease or not? So we use probability in determining that. I will end my part of the presentation here and give it to my colleague. Thank you.
Compliments of the day, ladies and gentlemen. My name is Estrid Timanubai, a proud student of the mighty Lusaka Apex Medical University. I'm doing my foundational stage of my Bachelor of Science degree in nursing, which is the pre-medical sciences in my first year, second semester. So I acknowledge all the speakers that have elucidated on a number of facets in terms of what we are looking at, functions and probability in medicine. So we have realized that functions and probabilities play a crucial role in medicine by modeling disease progression, survival rates, and patient monitoring. Also, we have realized that functions and probabilities are also used in diagnosis, risk assessment, treatment evaluation, epidemic modeling, and personalized medicine. We also gain understanding on how we are able to understand and apply functions and probabilities. Healthcare professionals can be able to make data-driven decisions that are ultimately going to improve patient outcomes. Ladies and gentlemen, I'd like to mention this, that through our journey of the intersection of functions, probability, and medicine, it has revealed the profound impact of mathematical concepts as we continue to navigate the intricacies of human health. It is now very, very clear, ladies and gentlemen, that these two, particularly functions and probabilities, are essential tools in the pursuit of medical excellence. We know that our hunger can never be quenched. We need excellence in the medical field. Allow me, Professor Lambatsa, to leave our wonderful viewers and listeners with this insightful question, thought-provoking question in mind. Pause for a moment as you digest this question. What if the next breakthrough was not a new drug or therapy, but simply a mathematical equation? Well, the possibilities are endless, and the future awaits us. This is you and I. Thank you so much, ladies and gentlemen, for allowing us within hearing range.
Thank you very much to our presenter. That was wow, right. I've really learned a lot today. Question on the back to you to do the robot point to the question and answer session.
Excellent. Thank you. Presenters, well done. Job well done. Now, before we move into the next session, can we have a roll call? You can simply write in the chat where you are listening from. How many of us are listening from any of our campuses, whether Mutandwa, Olympia, Chalala, any? Please indicate in the chat, let us know. What about those who are listening from any of our placement sites, whether it is UTH, Levy, Kitwe, Kabwe? Please let us know. We have Natasha, Premed, Chalala. We have Gertrude, Chalala. I assume this name is pronounced Lonnie. Premed, Twiza, Chalala. We have a lot in Chalala. This is good. This is good. We actually have quite a good attendance. So first of all, job well done to all of our members in attendance. Well done. We have, who else do we have? We have Future Sanji, USA. Please and thank you. You're most welcome. We also have Kapandula listening from Lusaka Central Correctional Facility. Well done. Job well done. Thank you for tuning in. We have somebody listening from Roma campus, and we have more from Chalala. A lot more from Chalala. This is good. This is good. Excellent. This is a very, very good attendance. Now, we will now move into question and answer session. Please bear in mind that there are no wrong questions. In you asking your question, you are opening the floor for others to speak more openly, to ask their questions and the like. So please, your question opens more doors, as well as this is a chance for you to get acquainted with online etiquette in form of how to ask questions, how to respond to questions, and just the overall flow of what it is like being a part of an online session. So please make the most of this. So you can either ask your question by raising your hand, the floor will be given to you, or you can write your questions in the chat and they will be read out for you. Please do not hesitate. The floor is open.
As we are typing our questions or thinking about the questions, remember that whatever I've covered today is in the curriculum. And as I mentioned earlier, the mathematics for year 1 semester 1 and year 1 semester 2 quiz. Some of the questions are going to come from today's presentation. This is part of the revision and preparation for the final examination.
Indeed, indeed. All right, perfect. So for those of you in attendance, class is in session. This is also revision. Ask your questions. If we do not, I can, and I will start calling names.
They say if people have no questions, it's only two things. Yeah, they've understood the subject very well, or they've misunderstood it very well.
Actually, we have a question from Natasha. What is the probability of someone with sickle cell having malaria? Once again, what is the probability of someone with sickle cell having malaria?
Yes, it's very important to understand. I think this question probably doesn't fit exactly to the mathematics that has been presented today, but it's something clinical, and that can be explained in pathophysiology. There are two things: sickle cell trait and the sickle cell disease. There's a tendency for those who have sickle cell trait to be protected against malaria. But those with sickle cell disease, it can be detrimental. And they are more likely to get malaria than those who've got sickle cell trait. The details are not for this discussion.
Thank you very much for the answer and guidance, Professor. HoD mathematics.
Yeah, maybe just to add on what the professor said. Yeah, it is. There is a tendency of observing that if somebody has a sickle cell carrier, there is an unlikely chance of getting the malaria parasite. But when he has it, it should be very severe. So like the professor said, the current presentation we have put here, we cannot easily put up a specific numerical value to say the probability that somebody has a sickle cell, given that has a malaria, is this one, or the other way around. Thank you.
Thank you very much. Any more questions? So what you want to say, I've come to do maybe pharmacy, medicine, nursing. What is the whole point of me doing mathematics? I'm sure you've appreciated today's lecture and seen the applications. Every subject that we do, very important. Back to the questions.
Thank you. We have one from Jimonia. Just appreciating the medical application of probability in medicine. Keep it apex, mom. This is Madam Chimunya Munachonga. We have one from Galaxy Note 8. This is excellent. We need more of such in our lectures. Okay. Misela says, best presentation, no doubt. Well done to everyone. We have another one, Timothy Monza, awesome team. Fun fact, this is the largest team of presenters we've had, so well done to Premed for breaking the record. Breaking and setting the record.
Yes.
So we have another comment. Lowell, this is cheering. Someone says, well done, guys. This is Sitole. Well done. Another one, we'll join next time, no doubt. We have another one, great presentation. This is a very positive audience. This is a very positive crowd. Well done, well done.
So the next presentation will be in chemistry. The students want to be a part of the team should contact the chemistry HoD.
Perfect.
Next time, you should be like politicians. You know what they do? They plant questions in the audience.
Yeah, we have the.
So we can go back to the presentation. Okay, so we are going to end with the we have a few questions for the audience. Right there, the images follows a specific probability distribution. Which type of probability distribution is most appropriate to model this scenario? Normal distribution, binomial distribution, Poisson distribution, or uniform distribution? We can type pick the best option. That is question number one. In a hospital, the number of patients arriving in the emergency room per hour follows a specific probability distribution. Which type of probability distribution is the most appropriate? Also, Poisson seems to be popular. Is the correct one? Okay, correct. We come to question 2. The number of patients who got the certain clinic between the hours 20 hours and 21 hours can be modeled by a random variable x having a probability distribution given by the equation below, where x equals 0, 1, 2, 3, and 4. Find the value of k. 2 over 15, 3 over 35, 9 over 35, 1 over 35. What is the correct option? 1 over 35 t. Is that correct?
Yes.
Okay, thank you very much. We have a sharp audience. Okay, suppose the probability of event A is 0.2 and probability of event B is 0.4. Suppose that events A and B are independent, then probability A over B will be what? What is the correct option to our third question? Probability of event A is 0.2, probability of event B is 0.4. Supposing that A and B are independent, then probability A over B will be what?
So we pronounce that one as probability of event A given he has already happened.
Okay, thank you very much for that. Can you go through again?
Probability of event A given that event B has already happened.
What is the probability of event A occurring from? Given that event B has already occurred.
Thinking that given one for answers,
B seems to be popular.
if they are independent, then the condition are not affected.
Meaning the answer of what?
B.
B. Okay, 0.02. Thank you. For 0.2. Then finally, the probability P equals 0.80 that a patient with a certain disease will successfully be treated with a new medical treatment. Suppose the treatment is used on 40 patients. What is the expected value and variance of the number of patients who will be successfully treated? What is the expected value and variance of the number of patients who will be successfully treated? I don't know whether the previous question or current one. Or the current one. B. Is that the correct answer? Yes. Our presenter has certified.
Yes, sir. B.
B. Okay, thank you very much. That was the final quiz question for today. Mission on the back to you. Oh, we didn't acknowledge the arrival of our DBC research. Thank you very much. Just went straight into providing answers.
I was listening.
Oh, you are listening. Okay, thank you very much for support, sir. Really appreciate it. Miss Chilolo,
I am here. Right. We have a very
Welcome.
smart audience. Job well done to our audience. Well done. Well done to all of you.
May I comment too?
I would now like
Dr.
to
Chiro,
invite our professorial team. Professor Lambert, please, you're most
Yeah.
welcome. Audience needs to know it's you.
No, I'm very excited to attend this run round. Very important application of mathematics in the medical field. That's very important. So what we are learning now, don't lose it. I appreciate your confidence and your free flow of presentation. Continue practicing like that. Now, what I learned from you, I think there are a lot of issues that we need to grasp, even as a practitioner. We are fond of, for example, dosage. We are fond of, you did mention that a lot of prescription, they will say, this patient, take this drug 3 times a day. Or in short, TTS. From your presentation, I think if you build on, you will see that this is the wrong way of giving patients that kind of instruction. Because what you mean, you have given 500 milligrams at 6 hours, and you say 3 times a day. Patient can take all the 3 doses within 6 hours. Yet a day will be 24 hours. So the best way, listening to your presentation, is to say, take this medicine 8 hours. Why? You want effective dose, concentration of medicine in the blood for 24 hours. So if you instruct the patient take 8 hours, is more informative than 3 times a day. To the patient may mean nothing. But looking at mathematics, the way you are applying this, I think it's the best way. Is the TDS means 8 hours. 3 times a day means 8 hours. So start at this stage, understanding this, so that in practice, we are getting patients healing with the proper dosages and properly described. Then you also talked about the heart rate. I was very happy. There's a natural pacemaker. We call it cyanoatrial node, SA node. You see, as you are reading the heart and the heart function. This was the node that was found 1907 by Dr. King. Very important. That's initiation of conducting the electrical flow into the heart. And there are cells, you did mention a few cells, the heart cells. And they take that, it can be rapid if it follows the Purkinje myocyte, or slow transitional. So the heart rate can go rapid depending on the state of heart or activity. And I was happy to hear that. Then you talked about exercise and heart rate. I was very good. What about resting time? What about sleeping time? Shouldn't the heart slow down? It should slow down. So as you grow in the field, you hear sympathetic drive and parasympathetic. It will come in you. But you are in the right direction. You should be understanding the heart rate and calculate the way you have been presented here. It is very good. The sensitivity part, we use it a lot in order to get the specific drug. We do send the password for culture and sensitivity. I think you looked after the issue of sensitivity, very important. So in practice, you meet that as well. Then there was a formula statement you made about the flow. Now there's a very good example of that. We call it brain must receive blood. And the brain is the most vital organ. So if someone is bleeding elsewhere, the body mobilizes blood in order to favor the brain. So we call it cerebral perfusion pressure. Now what happens is this. If the pressure in the head is growing and it's trying to block blood supply to the brain, what happens? The blood pressure, mean arterial pressure, must go up to match with the intracranial pressure in order to sustain cerebral blood flow, cerebral blood pressure. So there's a formula to that. You will come to find it in your practice. Those who are doing medicine, they will find it. Very important to know, because the clinical will be able to tell that this patient is it deteriorating, or is improving, or is stable. So all what you are learning is very useful. How I wish I could go back to pre-med years. I would have kept my notes. But that was 1971. I was your stage. What I'm trying to say, keep your notes. These days you can keep information. Build from one way to the other. You'll be the ones who'll be writing books in the future. Apex is training all this, but should also train teachers. Aim at becoming a teacher. And if you forget all this, how will you become a good teacher? You need mathematical application in medicine. I was even persuading Premed, why don't we have a section of medicine called biomathematics? That would be very good. And I'm sure the Apex Department of Mathematics, they are thinking of that. You can see this is mathematics which is inclined to medicine. I think let's be looking at that for the future sake. So I thank you very much for this presentation, and may God bless these efforts so that we continue getting better and better. You have heard the dean says we have questions. This presentation will come in one way or another, either continuous assessment or final exam. We never know. So keep this record very well. And the attendance was also very good. Presenter, very smart, very good. May we clap for you.
Just wanted to say something. I followed the discussion from the beginning. The time Anita got disrupted then John here. I appreciated the confidence which, a complex subject like this one was actually presented. This is what we now call demystifying science, so that people can understand that these two things are related. Just like tell us, you go to the market, you are given money, you buy orange for so much, you buy this for so much, how much will be remaining for what? It's mathematics for going to the market. Medicine is the same. I did appreciate some of the concepts that were even being introduced here that are very complex for people to understand. Like somebody was talking about Kaplan-Meier plots. We use them quite a lot in there. When the disease is occurring in somebody, you give medicines. At what rate do you expect them to recover? Those concepts were coming very, very clear. And I also liked what Professor Lambert has actually emphasized. Effective dose. The pharmacokinetics that was being demonstrated. Medicine is about pharmacokinetics. And if you do not understand the background as to why we give certain medicines once a day, Why some are given 4 times a day? But be careful mixing, because now it's like talking about interaction. That's now medicine. You know, because some of the drugs that you're talking about can actually enhance the other one and go into toxicity. Some of them, they're antagonistic. You give this one, don't expect the concentration to go up. It will drop very quickly because you've stimulated the fast cells in the liver. So medicine, you have to read it carefully. It's not just a 1 + 1, 2 thing that you get. Yes, something it's synergistic. 1 + 2 is equal to 4. You must understand that sometimes those things do occur. But I did really appreciate the amount of work that has gone into the background for you to come and simplify these seemingly complex subjects. In research, what you presented is exactly what happens. Learn to be comfortable with those things, then research will be very simple. Thank you very much.
Thank you very much for doing. He really reminded there's another group coming here. Yeah, so I think it finalized. Thank you.
Okay, thank you very much. Ms. Foka, over to you. We are done. Thank you.
A photo, Mr. Zulu. A photo. This is a very nice team.
Excellent. Job well done, presenters. And to mirror what Professor Lambert has said, please, at the end of this presentation, please make your way outside with the professorial team so that your portrait can be captured. This is history in the making. For those of you who have seen our professors' offices, they have photos of themselves and their colleagues back in the day. This is your moment to do the same for yourselves. So we have one more comment from Madam Priscilla. She says, thumbs up for teaching them. We are proud of the school. My niece is a student there. Estrej Mandiava. I hope I said this correctly. All the way from USA. Blessings to the staff and students. Thank you, madam. Thank you so much. We have come to the end of today's virtual presentation from Faculty of Premed every Monday, 13 hours. Once again, a gentle reminder, every day we have presentations. Monday is Premed, Tuesday, preclinical, Wednesday, research, Thursday, grand round. That is the case studies that our students find during their ward rounds in the hospitals. And Fridays, this is mixed disciplines. Thank you so much. Enjoy the rest of your day. Thank you.